Now, the noise, the shock, the memory, whatever it is that person has said to you, this could be ricocheting in your mind and bringing you back to physically where you were when you first got the ingredients for PTSD. Let's look at it all now. Post-traumatic stress disorder and what the research says. Post-traumatic stress disorder, or PTSD as it's commonly known, can develop from experience or a witness by a person of a traumatic event. Now, the symptoms vary from person to person, but generally they fall into four main categories. Number one is intrusive thoughts. Number two, avoidance, negative mood changes, and hyper-arousal. You've seen a couple of them right there at the top of this video. Let's look into them a little bit deeper. Now, if we have intrusive thoughts or re-experiencing symptoms, that means that we could have a quick flashback. And a flashback means that we are literally pushed the other side of a coin. It's flipped within the moment where we are suddenly in a physical room or space wearing certain clothes that all reminisced towards that particular instance, that experience where it was extremely stressful for us. We may smell the smells that was around, may see the people and the environment at which we are now in with regard to that experience. We're reliving it. And like a dream at nighttime where it could feel like hours, yet it may only be a few moments and it's flickering through your brain. It can be the other way. It can be time bound in certain ways, squeezed into your mind's eye. So feeling though and replicating and duplicating that this event is happening right now. It may then go into the bad dreams of us, nightmares. That's where we can have intrusive thoughts. Disturbing dreams can relate to the trauma. In fact, because the symptoms are so different for everybody, it can mean that during the day a person doesn't get distracted, they don't have the flashbacks, and all they have then is a horrible night's sleep every night where nightmares exist and persist. They may have distressing memories such as unwanted and uncontrollable thoughts that it's linked, because this is what the brain does. It links words people say, movies we are watching, small things, things in the background, like something on the wall, like a picture or a book, and you see the one word out of it and suddenly, boom, it's kicking things off. Emotional or physical reactions or triggers, like you may get very, very anxious or panicked or overwhelmed. Now, the thing is, when you're in the particular situation that you witnessed, or if you were really and truly in a situation where you're physically traumatized emotionally or mentally yourself, and you're the subject of that particular memory and that actual instance of happening, what can happen is at that time you're pretty calm about it. You get over it, and others are kind of going, wow, that's incredible. Like they're like iron. They don't, like they have nerves of steel here. Like what the heck? How can they do this? But it's later on. So your experience, whatever goes into you, is there. It does affect you. It's just we react differently, each one of us. Secondly, we can have avoidance behavior. So we might start consciously going, I'm not going to go there. Nah, it's fine. It's okay. Now, even if it's your friends that are going there, you used to like that place. And if they don't know about the trauma that you've experienced in that place, you might just go, nah, I'll just stay away. Or there could be people or situations. So again, a group of friends, one particular friend might have done something to you, rang you up outside of the group and accused you of something, or turned when they are in your presence, when the other lads or girls or guys are not in your presence. And so you feel as if, whoa, they're targeting me, and they're doing it very subtly. So you try to avoid them. You try to avoid then your friends and the places that you once loved. Emotional numbing can also occur, where you're feeling detached or disconnected from others and you don't feel anything at all. And let's face it, this is a feeling world. We have to feel something. That's why news stations are throwing things at us so that we get shocked or we feel emotional. If these things occur, that's when we can multiply that into a massive personalized identifying feeling towards the occasion when you suffer the trauma in the first place. And this is where the PTSD comes from. And this is how it feels so enriched when it does occur. We might be suppressing thoughts and memories, and we mightn't even realize it. So a conversation with a loved one or partner, especially if a partner witnesses us during the day and at night together, they can see when and where things are coming out. Like, after all, we don't know how soundly we sleep every night. We don't know if we're saying things in our sleep. We don't know that we are breathing a certain way. So a person who is physically near us or beside us can tell, and is probably well worth listening to. We can have negative changes in our mood and thinking. PTSD affects how a person sees themselves around others and the world. We can maintain and then develop, unfortunately, persistent negative thoughts, feelings of worthlessness, shame, or guilt, a loss of interest in our activities. We're no longer socializing, we're avoiding, but we might be avoiding a place that actually kicked off a memory for us. Instead, we might be avoiding certain things because we are ashamed of other things. So that's how we can find it difficult as an observer, a casual observer, a friend, somebody in a relationship or friendship, a family member, whatever, that is trying to help, knows they're off a bit, but can't link it to some past event. Maybe a difficulty feeling positive emotion, feeling emotionally numb or empty. When that happens, that's not something that should happen at all. We should be able to find something, someone, someplace that gives us a little bit of life that we look forward to. There must be memory problems, forgetting parts of the trauma or struggling with general memory. And that can be because we've consciously tried to blank it out. That was our protection mechanism in the first place when the event occurred. So when, again, you think a person is so calm and cool, when the event happens and it like makes other people nervous or dodgy or feeling bad in some way, in reality, a person might be just blanking it out and like saying, okay, that's that done, let's do this. And they just get on with things and they don't reflect on it at all. Whereas others over reflect, hyper reflect, get nervous around things straight away and are jittery, but at least they're dealing with things in some way, in a natural way. Then there's mistrust and detachment, feeling distant from loved ones or struggling with trusting others in the future. There can be a hyper arousal and increased reactivity. People with PTSD are often stuck in fight or flight mode. They are constantly trying to battle the reaction. It's like a delayed reaction of something traumatic. And so it's there until we deal with it and find a routine, find an acceptance level for us to move on. The hypervigilance can always mean that you're on high alert or you're looking for danger, you expect danger. You're easily startled, jumping at, say, sudden noises or movements. You're irritable and angry with your outbursts. And maybe you're difficult just getting to sleep, finding it difficult to stay asleep, that you're even afraid of the nightmares because you know they're going to ensue. It's going to occur. It's happened last night. It's happened regularly. It always happens this time of the year. Why? Because I know the anniversary of that traumatic event is coming up. You might have trouble concentrating. And these are the things that are going to make your present life, even if you get the good night's sleep, very, very tough. So it leaves a stain on the body, does PTSD. What can we do about it is another thing. Well, we need to go for therapy. We need to get people to help us. There are people, excellent mental health professionals out there, or your medical doctor. Please go to them too. And until that, thank you for watching, and please do watch more.